So fortunately, the field of HCC is very active, and actually quite a few trials are quite successful lately. So that is why the treatment landscape has changed so dramatically in the last 5 years. At this year's ESMO, there was one negative study that was of importance. That's the IMbrave050 follow-up data that showed that it's an adjuvant study in patients that are resected for HCC, and some of them also ablated. So in the first interim analysis, there was a significant benefit for treatment with Atezolizumab and Bevacizumab in patients resected versus active control. And now with longer follow-up, this significant improvement in PFS was lost. So this was a disappointment for the first positive adjuvant trial, actually. Yeah. Then there were other studies, for example, the LEAP-012 trial, which was a combination trial of TACE together with lenvatinib and pembrolizumab versus TACE in the other group. And that trial was able to show a significant improvement in PFS, but not OS, versus the TACE-only group. And that was a confirmation to one previous trial, also published this year, the so-called EMERALD-1 trial, where very similar results were shown. So this could open up an opportunity for triple therapy in a selected group of intermediate stage HCC patients. I personally don't think for all intermediate stage HCC patients. And then today, there were two more trial updates, I should say. There was the 5-year update of the HIMALAYA study, which was a big Phase III trial looking at the dual IO combination of durvalumab and tremelimumab versus sorafenib. That has been positive, and it's actually a registered first-line treatment. But 5-year follow-up is very unique for these trials because most of the other trials don't have such a long follow-up. And it was good to see that the benefit of IO combination treatment is consistently preserved over the course of 5 years. So after 5 years, there's still around 20%, so 1 in 5 patients with advanced HCC living in the combination treatment group, while it's less than 10% in the sorafenib group. The other update was from the BMS-90W study. That was also a first-line trial in advanced stage HCC comparing dual IO treatment with nivolumab and ipilimumab versus TKI treatment, which could be sorafenib or lenvatinib. In fact, it was mostly lenvatinib. And the data of that trial, were already quite strong. With 23 months or over 23 months median survival in the combination group versus still 20 months in the TKI group. And also here, the results were confirmed. It showed that the efficacy is preserved even with longer follow-up, and also that the toxicity that's slightly higher than with other combinations was still very manageable.